Some diphtheria cases. The family of Reverend Mr. Open of this city is afflicted with diphtheria. Mrs. O and her 4 children have been all down with it at once. He tells us that his wife was attacked with it on Friday morning, November 19th. By night, one of the children had it, and by the next night, all 4 of them. It is unlikely that if they had taken it one from another, they would have been attacked so nearly at the same time. He has attended many funerals in Wrightstown of children who have died of the disease and thinks that possibly the infection had been carried in his clothes. He has a new well, and the water has been analyzed and found to be pure. We have been particular in stating this case, hoping that it may induce care in others. The sick all are believed to be recovering. The Opens were lucky that they recovered. Unfortunately, there are many children during the diphtheria outbreaks that didn't survive, and for some families, almost all children died. This is from the newspaper Green Bay Advocate from February 1880. It reads, Mr. and Mrs. George C. Sanger were sorely afflicted on Monday morning last by the death of their daughter Ruth, who had been hovering between life and death for several days with that dread disease diphtheria. She was a lovely and promising child, a favorite among her mates, and she leaves aching hearts behind. Diphtheria is a bacterial infection that causes a thick layer of mucus in the back of the throat, making it difficult to breathe and eventually obstructing the airway completely, ultimately leading to death. An example of what people knew about diphtheria in 1880 is explained by Dr. Oliver Hess in his book, Diphtheria, Its Causes, Symptoms, Treatment, and Cure. They knew it was contagious, and they also knew it was most dangerous for children under the age of 16 years. This is a picture from a book in 1914, and it displays what the white grayish membrane looks like in the back of the throat due to diphtheria. The other picture, where it's nearly gone, is after the treatment. Other symptoms of diphtheria include fever, chills, nasal discharge, and tiredness. Swollen lymph nodes cause the neck to swell. This swelling in the neck causes changes to the voice and causes a barky cough. Just like how they explained it in 1880, an increase of phlegm and blood caused the swelling in the throat characterized by panting and pain, destroying the vital organs. The complications of untreated diphtheria are kidney failure, myocarditis, which is damage to the heart, and polyneuropathy, which is nerve damage. With today's technology and medical advances, including treatment, 1 in 10 people with respiratory diphtheria will die. Without any treatment, up to half of the people will die from the disease. This is the death certificate of Ruth Sager mentioned in one of the articles. Diphtheria was also referred to by other names found on death certificates of the past. A common name is croup. Also, there was acute croupice laryngitis. Also, as displayed from the articles, it was common for family members to be sick at the same time. This also meant that in the same families, members died near the same time. This is a brother and a sister, ages 5 and 3, on the same date, October 25th, 1886, passed away. This is part of the Hegstead family, Daniel and Miranda, who died on September 8th, 1879, in Edrick, Wisconsin. On September 12th, their sibling, Chauncey, passed away, and on September 18th, the last relative, the last sibling, Clement, passed away. All total, within 2 weeks, 4 children in the same family died from the same illness. Here is the Lloyd family. George, who died on January 8th, along on the same day was his sister Nancy. Then a few days later was Frank. This is the Hoff family from Little Elk Creek, located on the far east side of Buffalo County and far west side of Trempealeau. Albert, age 6 years, died on September 30th, 1879. Mary died age 5 years on October 7th. Amanda, at age 3, died on October 14th. And Peter, age 1, died on October 16th. This is the Nelson family from the same community of Little Elk Creek, Wisconsin. Martin, age 10, died on December 15th, 1879. Lena, 14 years, died on December 16th. Oli, age 2 years, died on December 18th. And Caroline, about 8 months old, died on December 22nd. Families and communities continued to be impacted by the diphtheria epidemic. These are just a few death certificates found digitalized from the state of Wisconsin records prior to 1907. There were many deaths of children from many different families. It's also important to mention that these are death certificates from just one county, Buffalo County, a rural one in western Wisconsin, just in the late 1800s. It was estimated that 10,000 people were affected in Wisconsin in the early 1880s. More than 2,200 people died. Many of them were in rural areas. A Wisconsin state law passed in 1883 required each city, village, or town to have a community health board and select a reputable physician, when possible, as the health officer. Not only did this improve the diphtheria rates in cities, but also in rural communities. The boards brought scientific medicine, which improved preventative measures in treating and preventing illnesses. They created programs with mass inoculations, educated on hygiene, and enforced sanitary codes. Doctors and scientists worked together to find better ways to treat the disease. New instruments for improving the breathing for children with swollen throats were improved. In 1888, the antitoxin was created and eventually leading to the development of vaccines for diphtheria. It started to become more widely used by 1914. There was also more advertisement and encouragement for families to get their children vaccinated to prevent diphtheria. And by 1949, the diphtheria vaccine was combined with tetanus and pertussis, both also very contagious infections. The rates of diphtheria drastically decreased after the antitoxin and even more after the vaccine. And the last known cases in the United States was in the 1990s. Today, in the 21st century, in the United States, the only known cases of diphtheria are related to international travelers. Diphtheria today is tested by swabbing the back of the throat. The results take time, and it must grow in a petri dish to confirm the bacteria causing the illness, and by then, the disease has caused symptoms to get worse. Diphtheria is prevented today with the vaccines given in early childhood as the DTaP, D as in diphtheria, T as in tetanus, and P as pertussis, which is also whooping cough. The vaccine is also given to adults as the Tdap, along with tetanus and pertussis. It's best practice to keep up to date with you and your children's vaccine status. Make it a point that every time you make a doctor's appointment to ask to be given any vaccines that you're due. This is the Kongsberg Church Cemetery in Russell, Wisconsin. The church dissolved in 1884. Most of the graves in the cemetery were children who died in the diphtheria epidemic of 1879 to 1880. The Hoff children, whose death certificates we saw earlier in this film, are buried here. We have the resources today to prevent diphtheria. We owe it to our ancestors to learn from their pain. Genealogists are reminded all the time how much vaccines have made a positive impact on humanity. We see the family trees with branches that are ended due to childhood deaths. Gertie Hagstead died in 1900. She had 9 children and only 1 lived to adulthood. The past is the past, but we can't help wonder how life would be different and possibly less sorrowful had the vaccines been around for the Hagstead family or the Nelson family or the Hoff families. We learn from our past to understand our present and to make our future better for those that come after us.